another class of antibacterial drug that is known as a Quinolone antibiotics or Quinolone antimicrobial or fluoroquinones. So Quinolone antibacterial. So as the name indicates, they will have a quinolone structure in their quinolone ring in the structure. That's why they are known as quinolone antimicrobials. So basically they are the derivative of nalidixic acid. So it is known as a non-fluorinated nalidixic acid. So it is the first member of family. जो quinol होता है उसमें पहला member होता है nalidixic acid. So all the quinolones are the derivative of nalidixic acid. Now nalidixic acid is no more used. All other fluoroquinones are used. So they are known as the bactericidal. They are a bactericidal. Fluoroquinones are the bactericidal. Particularly the second generation and third generation. Second generation जो होते हैं particularly. Okay? So fluoroquinones means इसमें fluorine होगा. Fluorine इसके structure में रहेगा. So non-fluorinated quinolone क्या है? Nalidixic acid. Non-fluorinated nalidixic acid. Fluorinated में आएगा आपका two classes. In case of fluorinated, you have two. In that also you have first generation and second generation. So this is known as a non-fluorinated one, and all other are the derivative of nalidixic acid. Now fluoroquinones means they will have fluorine in their structure. Okay, so they are further divided into two: first generation and second generation. This second generation fluoroquinones जो है, they are known as a broad spectrum. They are known as a broad spectrum fluoroquinones. First generation is a narrow spectrum. First generation is a narrow spectrum. So remember, इसके generation के ऊपर question आता ही आता है 100%. So they will give you the examples and will ask identify the second generation or identify the. So remember first generation fluoroquinones. So norfloxacin is there, ciprofloxacin, then ofloxacin and pepfloxacin. Cipro, nor, ofloxacin and pepfloxacin. These are the first generation. So you can यहाँ पे आप ट्रिक भी बना सकते हो ऐसा कुछ. So by using NCOP, इसमें कोई वर्ड बनता है तो आप उसको यूज करो. OPNC ऐसा कुछ. Then second generation drugs. Second generation में कौन आता है आपका? Second generation में levofloxacin आता है, moxifloxacin, gemifloxacin, then prolifloxacin, lomefloxacin and sparkfloxacin. Okay? So these are second generation known as the broad spectrum fluoroquinones. ये narrow spectrum होते हैं first generation. They are mostly used for the UTA and GIT infection. First generation. They are known as a narrow spectrum and they are used for only GIT infection and urinary tract infection. GIT infection or urinary tract infection. This particularly this levofloxacin, gemifloxacin and moxifloxacin. They are known as a respiratory fluoroquinones. They are used for the respiratory tract. And some of them are also used for the tuberculosis. Okay, so they have a broad spectrum. That's why. इसमें और एक आता है गैटिफ्लोक्सासिन. गैटिफ्लोक्सासिन जो है that is a ocular antibacterial. गैटिफ्लोक्सासिन एक आता है उसमें. तो quinolone antibiotics. Particularly उसमें fluoroquinone जो होता है वो important. They have broad antimicrobial activity. Particularly fluoroquinones. They have broad antibacterial activity, antimicrobial activity. Now what is the mechanism of action? They are nothing but they inhibit the DNA. They affect the DNA formation or they affect the DNA synthesis of bacteria by inhibiting the enzyme known as a topoisomerase enzyme. Topoisomerase enzyme is there which is responsible for the negative supercoiling of DNA. तो जो replication होता है we have seen in the replication. So at the one end your DNA helicase will open the double-stranded DNA structure, and at the another end there will be supercoiling. तो एक रस्सी है आपके साथ में, एक आपके हाथ में रस्सी है, तो आप एक जगह पे टाइट करो, उसको बांध दो और एक जगह एक साइड से क्या करो, उसको निकालो. तो एक जगह एक साइड से निकालोगे तो दूसरी साइड पे क्या होगा? कॉइलिंग टाइट होगा. दैट इज नोन एज सुपरकॉइलिंग. So DNA is like your twisted rope. So if you open the strands at one end, so there will be supercoiling over another end. Okay. So during the replication, so due to separation of two DNA strands by DNA helicase, so at the another end there is a supercoiling, and after the DNA replication, that supercoiling should be removed. Replicated DNA should be isolated from that original DNA. Replicated DNA should be separated from that original DNA. That is done by DNA gyrase. And DNA gyrase is also known as DNA topoisomerase. Okay, so it prevents the supercoiling. Okay, so it has a negative supercoiling. Now in the DNA replication वहाँ पे positive supercoiling होता है. So they causes the this DNA gyrase, they causes negative supercoiling. तो ये important होता है कि जो coiling हो चुका है supercoiling वो उसको remove करना है. वो उसका काम किसका काम है? DNA gyrase का और topoisomerase का. So bacteria when bacteria will synthesize its DNA, so at that time there will be supercoiling of bacterial DNA at one end, because at the another end there is a replication going. So after completion of replication, that replicated DNA should be separated from parent DNA. That supercoiling caused during the replication, that should be relieved by DNA gyrase. That is a normal thing. Now this Quinolone, what they do, they inhibit the DNA gyrase enzyme. So they inhibit the DNA gyrase enzyme. तो DNA gyrase को inhibit करेंगे. Inhibit करने के बाद में क्या नहीं होगा? तो obviously the supercoiling. Okay, so inhibition of DNA gyrase causes the. Okay, so inhibition of DNA gyrase, उसको अगर inhibit कर दें तो उसका काम नहीं कर पाएगा. तो DNA gyrase will not be available to make negative supercoiling. So जो positive supercoiling आपका हो चुका है किसमें? Replication की वजह से. So उसको relieve करना है. That is the role of DNA gyrase. But now you are inhibiting DNA gyrase, so negative supercoiling will be prevented. So Quinolone antibiotics, they binds to the DNA gyrase and DNA topoisomerase. So these two enzymes will have a different role. So DNA gyrase, so this enzyme is responsible for the nicking of double-stranded DNA, introduction of negative supercoiling, and then reseal the nicked ends. मतलब जहाँ तक replication start है, replication end होने के बाद में जहाँ पे बंद हो गया, so वहाँ पे जो end होता है, that should be sealed. Okay, जो end होता है last में वो seal होना चाहिए by particular sequence of base pair. ठीक है? So that sealing, relieving of supercoiling, that is a function of DNA gyrase. Now your fluoroquinones, they are inhibiting the DNA gyrase. So what will happen? So bacterial DNA will not be, the supercoiling of bacterial DNA will not be relieved. So it will remain as such, and that is useless. That is useless. That means that will damage to DNA. And if there is a damage to DNA, bacteria will die. And also these fluoroquinones, they are direct action. They can arrest the DNA replication. Arrest मतलब stop करना. So they will stop the replication. These fluoroquinones, they are DNA gyrase inhibitors. Again, they also inhibit the DNA topoisomerase 4. This enzyme is also responsible for the nick sealing and separate the daughter DNA strand after replication. तो replication होने के बाद में जो नया DNA बना है उसको separate करना है parent DNA से. That function is done by DNA topoisomerase 4. These are inhibited by fluoroquinones. DNA gyrase inhibitors, they are DNA gyrase inhibitors. They are DNA topoisomerase 4 inhibitors. So this also leads to arrest the replication. Fluoroquinones, they inhibit this topoisomerase 4, so arrest the replication. Now these drugs act by blocking these enzymes. So fluoroquinones, they block DNA gyrase as well as DNA topoisomerase. तो दोनों का जो मेन फंक्शन है, DNA gyrase का फंक्शन होता है कि निगेटिव सुपरकॉइलिंग जो पॉजिटिव सुपरकॉइलिंग हुआ है तो उसको कॉइलिंग को कम करो, मतलब निगेटिव सुपरकॉइलिंग उसका काम है. जहाँ पे रेप्लिकेशन खत्म हुआ है वो जो एंड है, that is known as a nick end. That end should be sealed with the some particular base sequence. That is a function of DNA gyrase. So if it is inhibited by this quinolones, so the enzyme will not this enzyme will not be able to relieve the supercoiling caused by replication. So supercoiling will remain as it is, and that will damage the DNA, and that's how bacteria will die. Okay, then again fluoroquinones also inhibit this enzyme DNA topoisomerase 4. What is the function? Again it is involved in the sealing of nick. जो एंड बचा है रेप्लिकेशन के बाद में जो एंड एम्प्टी है तो उसको सील करने का काम ये करता है. बेस पेयर सीक्वेंस वहाँ पे ऐड करेगा. So this enzyme is also inhibited by this topoisomerase is also inhibited by quinolone antibiotics. Again this topoisomerase has one more function to separate the daughter DNA after replication. ठीक है, तो इसका काम है कि निक भी सील करना है और daughter DNA जो बनाया नया है उसको सेपरेट करना है. अगर इसको भी इनहिबिट किया तो daughter DNA will not be separated and replication process will be arrested. That's how this quinolone antibiotics they will act. They are a bactericidal drugs. Okay, now what is the spectrum of activity? They are effective against the gram positive. They are effective against the gram negative bacteria because of the action A. Because of the inhibition of DNA gyrase, they are active against the gram negative bacteria, and they are also effective against the gram positive bacteria due to inhibition of DNA gyrase enzyme. They are effective against the gram negative bacteria. Due to inhibition of DNA topoisomerase 4, they are effective against the gram positive bacteria. So they are a broad spectrum. इसमें क्या है, broad spectrum है उसका, क्योंकि they are killing both gram positive plus gram negative bacteria. तो उस broad spectrum. अभी देखो generations of cephalosporins. जो पहले दिखाया था वो KD त्रिपट एक क्लासिफिकेशन था, जो टी डायग्राम टाइप था, उसमें दो ही क्लास दिए, उसमें दो ही जनरेशन थी in a various different reference books. So I have listed here four generations. Now these generations are very important on the cephalus. Okay, on the this quinolone antibiotic they used to ask the question on this generation. Now first generation drugs, they are known as a narrow spectrum drug. For example, norfloxacin, ofloxacin and pegfloxacin. Norfloxacin, ofloxacin and pegfloxacin. These are known as the first generation or narrow spectrum fluoroquinones. Now second generation, lomefloxacin and ciprofloxacin, moxifloxacin, levofloxacin, sparfloxacin. So out of that, sparfloxacin is the longest and gatifloxacin is a locally used. It is adverse effect, so it is not used systemically. Gatifloxacin systemically is used. Fourth generation, they have a broad spectrum, trovafloxacin and gemifloxacin. Trovafloxacin and gemifloxacin. They are known as a fourth generation. तो ये जनरेशन का क्लासिफिकेशन याद रखो. फर्स्ट जनरेशन में क्या आता है आपका, नॉरफ्लोक्सासिन, ओफ्लोक्सासिन एंड पेफ्लोक्सासिन. सेकंड जनरेशन में आता है आपका लोमीफ्लोक्सासिन एंड सिप्रोफ्लोक्सासिन. थर्ड जनरेशन में आता है आपका मॉक्सीफ्लोक्सासिन, इवोफ्लोक्सासिन, स्पारफ्लोक्सासिन एंड गैटिफ्लोक्सासिन. फोर्थ जनरेशन में आता है आपका trovafloxacin and gemifloxacin. So we'll see individual drug regarding individual drug. First one is a nalidixic acid. So which is the first member of your quinolone family. Most of the gram positive gram negative bacteria, especially E. coli, then Shigella, so they are sensitive for nalidixic acid. Most active against the gram negative bacteria, especially E. coli. So E. coli सबसे ज़्यादा क्या करता है, UTI करता है. Most of the UTI, urinary tract infection, is because of the E. coli, and that's why fluoroquinones they are very effective in case of urinary tract. What are the adverse reactions? That is nothing but the nausea, vomiting, diarrhea, photosensitivity. Seen इसके ऊपर drowsiness, convulsions in the children may increase the intracranial pressure in the children. Okay, now fluoroquinones. The actions of these fluoroquinones they are also similar to your nalidixic acid, but because of the fluorine in the structure of fluoroquinones, they are known as the fluoroquinones. nalidixic acid का स्ट्रक्चर जो है उसका स्ट्रक्चर के जैसे ही फ्लोरोक्विनोन का स्ट्रक्चर होता है, but they have additional fluorine in their structure. That's why they are known as fluoroquinones. They have structural similarity with the nalidixic acid, but they have additional fluorine atom. So fluoroquinones. What is the spectrum of activity? कौन से microorganism मरेंगे? So as I have told you that fluoroquinones are the broad spectrum. So they will kill. They are effective against the gram positive as well as gram negative bacteria. They are very effective in case of this E. coli, Klebsiella organism, Proteus. Then they are highly effective against the Salmonella, influenza, okay, influenza H, influenza, and microorganisms which are resistant to penicillin. This is gram negative bacteria. So in case of gram negative, penicillins are not effective, but these fluoroquinones are effective. So those organisms which are resistant to penicillins, they are effective against them. Fluoroquinones they are highly effective against the Salmonella, H. influenza, Haemophilus influenza, and other microbes which are resistant to cephalosporins, penicillins, aminoglycosides, chlorphenicol. So that's why they are known as a broad spectrum antibiotics. तो ये gram negative को भी effective है उसके अगेंस्ट में. They will kill gram negative bacteria, gram positive bacteria, E. coli, Klebsiella, then Proteus, Mirabilis, then Salmonella, Haemophilus influenza, and other organisms which are resistant to penicillin, cephalosporins, then aminoglycosides, chlorpenicol. They are also effective against the acid-fast bacilli, that is Mycobacterium tuberculosis. तो फ्लोरोक्विनोन्स में भी कुछ ड्रग्स है जो टीबी में यूज करते हैं. दे आर नोन एज अ रिजर्व ड्रग. ठीक है, रिजर्व ड्रग, नॉट अ फर्स्ट लाइन ड्रग. So these fluoroquinolones, if they are used in the TB, they are known as a reserve drug. These drugs can develop resistance generally by genetic mutation. So certain bacteria like Pseudomonas, then Staphylococcus, they have developed the resistance to these fluoroquinolones. So they are very good antibiotics, but nowadays also they are getting resistance because of the irrational use of these antibiotics. Because of the irrational use, कोई भी आके एंटीबायोटिक खा रहा है, उसकी वजह से क्या हो रहा है, रेजिस्टेंस हो रहा है. नाउ ADME, absorption, distribution, metabolism, and these drugs will have very good bioavailability after oral administration. And these drugs, their bioavailability is decreased by presence of these compounds. जैसे आप एंटासिड लोगे, if you take antacid syrup with these fluoroquinolones, so antacid syrup will decrease the bioavailability of these drugs. So compound like aluminum, magnesium, zinc, calcium, iron, because these ions they form complexes with the fluoroquinolones. Presence of food in the stomach also decreases the absorption. They are concentrated in the urine, kidney, and prosthetic tissue. Adequate level of these drugs are also found in the lungs, bones, as well as because these drugs has a fluorine atom in their structure. That's why these drugs can get access to the bones also. बाकी drug का bone तक जाना possible नहीं होता. As these drugs has a fluorine atom, so they can reach to one. याद रखो उसमें जो aluminium hydroxide होता है, magnesium triosilicate, zinc, calcium, and other metals, if they are taken together with the fluoroquinolones, they will form a complex system. Again, जैसे tetracycline के साथ में भी वही होता है. If you take a tetracyclines with the antacids or milk product, so again their absorption will be decreased due to chelatation. Same is true with this fluoroquinolones. Adverse effect. Again, it is very important point. Adverse effect. So first ये भूख न लगना, vomiting वालों में abdominal discomfort मतलब abdomen में pain होगा या फिर so remember out of that provafloxacin, it can cause severe hepatotoxicity. Provafloxacin can cause severe hepatotoxicity. On the CNS, they can cause confusion, nervousness, agitation, hallucinations. Rarely they can induce the seizures, that is convulsions, especially in the patient receiving the isoniazid, theophylline and NSAIDs. तो अगर कोई पेशेंट को आइसोनियाजाइड दिया है टीबी के लिए या फिर थियोफाइलिन चले उसको अस्थमा के लिए, उसमें अगर फ्लोरोक्विनोन्स यूज करेंगे तो दे कैन कॉज कन्वर्जेंस, कंफ्यूजन, नर्वसनेस, एजिटेशन. मेन एडवर्स इफेक्ट टेंडन एंड कार्टिलेज डैमेज. क्वेश्चन इसके ऊपर आ चुका है. सो फ्लोरोक्विनोन्स दे एज आई हैव टोल्ड यू, उसमें फ्लोरीन एटम होता है एंड फ्लोरीन एटम बिकॉज ऑफ दैट फ्लोरीन एटम दे कैन गेट एक्सेस टू द बोन्स एंड टेंडन्स. तो वहाँ पे बोन्स को जाके अटैच करेंगे, वहाँ पे टेंडन्स को जाके अटैच करेंगे एंड दे विल रप्चर योर टेंडन्स, दे विल डैमेज योर कार्टिलेज. सो रप्चर ऑफ शोल्डर्स एंड अचेलिस टेंडन्स, तो ये टेंडन्स को रप्चर करेंगे. दे आर रिपोर्टेड विद these drugs and require surgical repair. अगर उन्होंने कुछ डैमेज किया आपके टेंडन्स को, so you have to repair it by surgical. Treatment should be discontinued if patient experiences pain, inflammation and rupture of tendons. तो अगर टेंडन्स का रप्चर कर रहा है तो they should be avoided in the pregnant and nursing mothers and also should be avoided in the young children. तो ये adverse effect याद रखो. टेंडन डैमेज, कार्टिलेज डैमेज, टेंडन रप्चर, कार्टिलेज डैमेज. क्वेश्चन जीपैट में इसके ऊपर आ चुका है. क्वेश्चन आ चुका है जीपैट में. आई थिंक जीपैट 2020 में आता है. तो टेंडन और कार्टिलेज डैमेज इज अ एडवर्स इफेक्ट ऑफ फॉलोइंग एंटीबायोटिक्स. सो fluoroquinolones they will affect the tendons and cartilage. Tendon rupture. Allergic reaction also reported. Like again they will also have photosensitivity reaction. मतलब जैसे अगर इनको खा के अगर आप ये टैबलेट लिया आपने और आप गए धूप में तो आपके स्किन के ऊपर रिएक्शंस होंगे, तो फोटोसेंसिटिविटी रिएक्शन. सो ल्यूकोपेनिया, renal damage in case of renal failure. Now uses, specific uses, again it is very important. Norfloxacin, so used in the urinary tract infection, GIT tract infection, and it binds to plasma protein, and that's why. So use क्या है इसका urinary tract infection, GIT infection. Suppose you are suffering from diarrhea, then physician used to prescribe you this medicine frequently, norfloxacin, norflux TZ, yellow color का tablet आता है. That yellow color tablet not containing norfloxacin plus nidazole. Okay, so combination of norfloxacin plus nidazole. So most frequently used for GIT infection like diarrhea, dysentery. Also used in the treatment of urinary tract infection. Now it is metabolized by, it is mostly metabolized by renal. So it is metabolized in the kidney and liver. Ciprofloxacin also used in the UTI, urinary tract infection, used to treat the gonorrhea, gastroenteritis, joint and soft tissue infections. Used particularly gram-negative organism infection due to gram-negative. Ofloxacin and pifloxacin similar to cipro. Ofloxacin is also similar to norfloxacin. Parfloxacin, levofloxacin, gatiploxacin, moxifloxacin, demifloxacin. They are known as a respiratory fluoroquinolones. इसके ऊपर भी क्वेश्चन आ चुका है. Parfloxacin, levofloxacin, gatiploxacin, moxifloxacin, demifloxacin. They are known as a respiratory fluoroquinolones because they are useful in the respiratory tract infection. Most of them are caused by pneumococcal bacteria, pneumococcus. They have very excellent anti-pneumococcal activity. That's why they are useful in the respiratory tract infection. Levofloxacin is a levoisomer of ofloxacin. Levofloxacin. Levofloxacin is a isomer of levofloxacin is a levoisomer of your ofloxacin. Then ofloxacin and sparfloxacin, they are effective against the acid fast bacilli. Ofloxacin, sparfloxacin, levofloxacin. These are the effective against acid fast bacilli. Therefore, they are used in the tuberculosis. So in the leprosy. The result drug. They are the drug of choice in treatment of typhoid fever. Drug of choice in case of typhoid fever, which is resistant to the chloramphenicol. So first drug of choice in the typhoid fever is a chloramphenicol. But अगर chloramphenicol का resistance है, तो आपको इसमें chloroquine use करना. So they are drug of choice in the treatment of typhoid fever. And to chloroquine. Ceftriaxone is the most reliable entry cure और typhoid के लिए ceftriaxone. Ceftriaxone क्या है? It is the cephalosporin. And we will see cephalosporin. Ceftriaxone is cephalosporin, which is the most reliable state acting and bactericidal drug in case of typhoid fever as well as enteric fever. Okay. What is the use? UTI, gonorrhea, bacterial gastroenteritis, bone and joint tissue infection, gynecological and wound infection, gram-negative bacteria, septicemia, respiratory. Okay. Most important point: parfloxacin and gatiploxacin. They can produce arrhythmia. They can prolong the QT interval of your ECG. ECG होता है EQRS वेव, EQRST वेव. उसमें QT वेव जो है उसको prolong करेगा, उसका डिस्टेंस बढ़ाएगा. तो parfloxacin and gatiploxacin. That's why they can produce arrhythmia. They produce arrhythmia. That's why they are no more used. Gatiploxacin is mostly used for the topical. Okay, gatiploxacin is withdrawn from market due to glycemic effect. इसके ऊपर क्वेश्चन आ चुका है. Glycemic effect मतलब क्या? So sometimes it will increase the blood sugar. Gatiploxacin is withdrawn from market due to this glycemic effect. Fluoroquinolones withdrawn from market because of their respective disorder or respective adverse effect. Say, for example, fluoroquinolone, it can cause immunohemolytic anemia, autoimmunohemolytic anemia. Temafloxacin. Temafloxacin क्या करता है? autoimmunohemolytic anemia करता है. Provafloxacin. Provafloxacin क्या करेगा? It's a severe hepatotoxicity. Grapafloxacin, it will cause cardiotoxicity. Cinafloxacin will cause phototoxicity. तो आपको ये मालूम होना चाहिए कि कौन सा ड्रग का एडवर्स इफेक्ट क्या है. And most of the fluoroquinolones, particularly those which will affect your cardiovascular system, they have been banned. Parfloxacin, gatiploxacin. So gatiploxacin is withdrawn from US market due to this glycemic effect. बाद में temafloxacin will cause autoimmune hemolytic anemia. Then provafloxacin will cause hepatotoxicity. Then grapafloxacin will cause cardiotoxicity. Fluoroquinolone phototoxicity. You have to remember. So serious toxicity, they are nothing but the seizure and increased. Seizures are increased with concurrent use of ACIDs and fluoroquinolones. Non एनालिसिक एंटीबायोटिक अगर फ्लोरोक्विनोन के साथ यूज करते हो तो समटाइम्स सीएनएस टॉक्सिसिटी में भी इंक्रीज